Hello everyone, my name is Netra Kher. Namaste. Today's talk will be very special to me. I'm a counseling psychologist by profession and Ayurvedic practitioner. As I said, today's talk will be special. It is a next talk of our interview series of understanding bipolar disorder. Okay. In that, we will be talking about doctor's perspective today. We are meeting Dr. Milan Balakrishnan. Namaste, doctor, who is an eminent psychiatrist in Mumbai, who practices in Bombay Hospital. He also practices in Masina Hospital, and he is also on panel of Bipolar India group. Okay, so I welcome sir in today's talk.
Thank you,
My
Netra.
yeah, my first question to you is, can like as we have discussed seen in earlier video that we have seen myths and facts about bipolar disorder. We have seen what is bipolar disorder. So there is mania, there is depression, there is euthymic mood. Everything is there. There are different stages of moods, and they are extreme in nature. So can that kind of person live a normal life? Like, for example, completing education, yeah, or take uh, having a daily living,
Right.
yeah, or getting married. Are these things possible for a person who is diagnosed with uh, bipolar disorder?
Absolutely. Definitely, we have patients with bipolar disorder living perfectly normally, and we know very well that there are a lot of very well, very well functioning individuals who have suffered from bipolar disorder, including celebrities that we often talk about, uh, whether it's Jim Carrey or whether it was Robin Williams. Uh, all of them lived almost a normal life, and uh, you know very well that a person with bipolar disorder otherwise looks exactly like you and me. There's nothing that should prevent patients with bipolar disorder from living a normal life. The only difficulty is, however, being these episodes that come and go. And with bipolar disorder, there is much more of episodicity, which makes it possible that between episodes you can live an absolutely perfect life. Uh, During an episode, also with with regular treatment and proper treatment, we could minimize the problems that are caused by the episode, whether it is the manic episode, the hypomanic episode, or the depressive episode. We can control it to an extent that he or she can lead a reasonably normal life. Also, in bipolar disorder, the aim of treatment is prophylactic, meaning it is the aim of treatment is often to prevent future episodes.
Okay.
So, if and with regular treatment, we find that the episodes become less and less common. The gap between episodes increases. The duration of the episode decreases. So, all of these factors will help person live perfectly well with bipolar disorder.
Okay, and what are the chances of recovery if a person get diagnosed with bipolar disorder? How much are the chances of recovery, or that person will be in that extreme state in one or the other?
So these, like I said, these episodes are not otherwise long, right? So even in an untreated case, a depression episode will not last more than 6 to 8 months, even when untreated. But
Okay,
yes, uh, that 6 month period can be very difficult and distressing for that individual. So being episodic the whole nature of the illness is such that you go from an episode into remission back into an episode. So the aim of treatment is to maintain the patient in remission for as long as possible. By remission, I mean at a stable mood, neither in a high, which we talk about as hypomania or mania, and neither in a low, which we talk about as dysthymia or depression. So,
Okay.
keeping the patient euthymic is the aim of treatment, uh, and absolutely, uh, majority of the patients, in fact, can be maintained in this euthymic phase. There may be breakthroughs in between, which need to be managed, but majority of their life they can lead as normally as you and me.
Okay, great to know that as bipolar disorder patients can also live a normal life. Next question from my side, sir, is are there any the genetic components in bipolar disorder from like passing from generations?
Definitely. Uh, with mental illness, uh, genetics is always an important factor because uh, with serious mental illnesses like severe depression, bipolar disorder, schizophrenia, etc., there seems to be uh, there seems to be a cluster of genes that put patients at risk for developing the disorder. Now, the problem is there are multiple genes, and so there is no way to say which one is active when and what it's
Hmm.
exactly causing. It seems to be a polygenetic inheritance, which makes it difficult to uh, really pinpoint, right? But genetic factors are definitely uh, common, and in if one of the parents has bipolar disorder, the chance of the child having meaning the child eventually developing bipolar disorder is about 8 to 10%.
Okay,
If for example both parents have bipolar disorder, the chance of the child developing bipolar disorder in the future may be close to almost 30 to 40%. So genetics are definitely in a previous generation there is a patient with mental meaning with bipolar disorder, then the chance of uh, having bipolar disorder is close to around 8%. So the genetic component is definitely quite strong. Otherwise, in the general population, the chance of getting bipolar disorder is about 2%. So
okay,
uh, you have a strong family history. Um, So, uh, genetic factors and brain neurochemicals are definitely uh, playing a huge role in bipolar disorder, and that's where bipolar disorder is a largely neurochemical driven disorder, and hence medical treatment is the core, with psychotherapy and supportive treatments being the second rung. But medication cannot be substituted by these. That is important to remember in severe mental illness. In many other mental illnesses, psychotherapy may be the core, with medication being supportive.
okay.
So it's important to note that certain disorders are more powerfully driven by biochemical changes, and these need to be treated more aggressively with medication.
Okay, sir, thank you so much. Following with data as you supported, which was very important, and statistics which you stated was very enlightening for us. Next thing is, are there any new researches coming up, new treatment plans coming up for bipolar disorder patients?
Right. Uh, Definitely newer and newer treatment plans in terms of
Or new
medical
medicines, new
treatments, yeah, medical
medicines.
treatments, as well as uh, whether the most of the research is centered around trying to identify the genetic inheritance and seeing if any modifications can actually happen at that level to prevent bipolar disorder. but also more and more drugs are being more and more drugs which can be used more effectively as mood stabilizers are also being worked on. The neurochemicals are also being understood further. So earlier, our predominant neurotransmitter in most disorders was dopamine or serotonin. Now the shift is to glutamate, which is a more which is a neurotransmitter that sort of works throughout the brain. So there is a shift in terms of the types of drugs that are being used. But yes, still, in spite of all the research, the oldest drugs seem to be the most effective. So
Okay.
lithium, for example, or valproate or carbamazepine, for example, still have found to have the best outcomes. Newer drugs are seen as sort of uh, secondary options in case these are not working. Secondary options in case these are having side effects that are severe enough that we can't use them. So there hasn't been a really very powerful drug lately that seems to replace the previous ones. Uh, but that's besides that, uh, work is also on uh, or to see if there are newer treatments, especially in the depression part of the story, where there are newer treatment options like ketamine being tried. There are
Vitamin
cannabis
therapy.
derivatives that are being tried. Yeah. Also, we have RTMS and TDCS, which are brain stimulation treatments that are being used more commonly in the depressive episodes, which don't seem in those cases which don't seem to respond to standard medication. So these are again more supportive, more secondary, but those are all the new changes, as well as, of course, looking at how we can use a good mix of medication and psychotherapy to support people through the episodes, and also during the inter-episodic interval, because stress has been proven to be a risk factor for episodes to start off. So that's where there's a lot of role for uh, working on lifestyle modifications, managing stress better in order to decrease the risk for episodes.
Okay, as you mentioned right now about ketamine therapy, can you tell me more about it? And
Okay.
another part is what is your take on ECTs or electroconvulsion therapy, which is being given to depressive patients to come out of it? It is as earlier many people used to use it. Still, many people use it for treatment. Few
Absolutely.
people, there are opinions that it is useful in some cases, useful, not useful in other cases. So, what is your take in that?
Right. So when we talk about ketamine therapy to begin with, it is, like I said, still a bit of an experimental treatment. It's not an established uh, treatment in the sense that uh, the FDA or the DGCI regulations don't yet accept ketamine as a standard treatment choice for depression. So it is a newer form of treatment. But ketamine does have its benefits, especially in very severe depressive episodes. Severe
Suicidal
depression with
ideations.
Yes, severe depression with suicidal ideation. Ketamine does have a very useful role, and ketamine has sort of emerged as a substitute for ECT in that group, because that's
Yeah,
clearly a group that would have warranted ECT therapy. But for patients who would, for example, refuse to take ECTs, although ECTs are the much more proven and established form of treatment, and a patient still refuses ECTs because of the beliefs around ECTs, or because of stigma, or just because of fear, ketamine seems to be uh, an option there. Um, what it does is it quickly brings down depressive symptoms, and usually we would administer ketamine. It's almost like an OPD procedure. You can patient walks in, is given injectable ketamine as a drip, which may continue for about 40 minutes. Once the patient is uh, out of the effect of ketamine immediately, he or she can go home and then come back next week to administer the ketamine again. Usually, about 4 to 6 doses are given, and at a week's interval, and mood tends to pick up quickly. But yes, it doesn't mean that these patients will not continue to need maintenance treatment in the form of other drugs. So ketamine is more like an acute treatment for them, or for those who don't seem to respond adequately well to standard drugs.
Okay. Thank you so much, sir. What should be role of family in this difficult situation? Uh,
Right. I The only thing that we didn't answer was the question of ECT, which is also very important.
okay, sorry.
The Yeah, ECTs are, like I said, a proven long-term treatment. So they are not, can and should be continued to be used. Over years, the safety profile of ECTs has only gotten better. They are in no way dangerous to the patient. In fact, the side effects related to ECTs are much fewer than with standard drugs, right? Because ECT is a one-time thing, or during the course, whatever 6 to 8 ECTs may be given, but they are usually spaced over a couple of days. So that way, it is a very safe treatment, very effective treatment, uh, very useful in cutting down the length of treatment, for example, especially in
Okay.
patients with severe depression. It's going to take a lot of time with medications for them to recover. With suicidal ideation, especially, it's better since you can quickly institute it. Mood will get better quickly. Risk of suicide becomes less. While with drugs, that that process may be longer and the risk of suicide is higher. So
Yeah.
that's where ECT definitely has an advantage over drugs in a large group of patients. So it is a very safe treatment. There's no doubt about that. The fears around ECT usually uh, come from our beliefs, or from what Bollywood has shown us, or from what we hear from people. So that in that sense, we need not fear ECTs. And if anybody offers you ECTs for a particular disorder, there is no harm in taking it. Personally, if I was suffering from severe depression and ECTs were offered to me, I would absolutely take it. Um, yeah. And about family, yes, the role of family in any mental health issue, in fact, uh, generally also is very important and vital, right? More so in a disorder like bipolar disorder, where there are uh, lots of ups and downs. So if the family is not able to understand the disorder, it does create a lot of trouble, because often the patient is blamed as being as the troublemaker. He's acting, he's pretending, he's just harassing us. He sometimes seems to be okay, sometimes he behaves like this. So that creates a lot of confusion and a lot of anger towards the patient from the relatives, which puts again the patient at risk for further episodes, because stress levels will obviously be high. This also makes the disorder itself also makes patients more prone to use substances like alcohol, nicotine, or any other substances, cannabis, etc. And this again, the substance use also starts having an impact on the family, and the family in turn will also impact the substance use. So it becomes a very vicious cycle, and that's where it is very important that the family and the patient both understand the disease equally well. Uh, Family to be able to support the patient through the episodes. During the inter-episodic period also, family being available to ensure that the patient is compliant, patient is continuing to take his treatment, whenever things go wrong, also the family is available to quickly get into seeking help. And but yes, the family is also are at high risk for burnout. It's very tiring to deal with patients with
Hmm.
mental illness, especially if they have more intense episodes and require hospitalization. So it does have a very long-lasting impact on the family as well. So that's where I think as doctors, as therapists, we need to check in often with the family as to how they are doing. What is it they're feeling? How are they managing this? What are the difficulties that they are facing? So very often we find families of spouses, especially of bipolar disorder patients, often experiencing depression or anxiety themselves, or even parents experiencing severe depression because they're constantly under the fear that the patient will have an episode. So dealing with that is also vital.
Okay, and I think then the role of support groups here plays an important role, where they get support from similar kind of patients, families, and how they are dealing with their family members and the patient
Absolutely.
also. Okay,
Yes, yes.
uh,
So
yeah.
support group play a very hugely important role. Like the Bipolar India support group, I think it has helped so many families uh, ease out the difficulties related with the disorder, and also has helped a lot of families get into treatment much earlier than they would have normally done. And with all mental illnesses, the earlier you institute treatment and seek help, the better is the outcome always.
Okay. How much therapy is important? As you said, it cannot be substituted. Drugs cannot be substituted by anything else. So drugs are important. No one is denying that fact. But how is therapy also important in bipolar disorder?
Definitely, therapy is uh, quite important. More important in two phases. One, in the interim episodic phase, when the patient is otherwise seems to be normal, that's where therapy can have a large role, as individual as well as family interventions, which will help, like I said, prevent a lot of increased stress. And this stress is one of the major causes for breakthrough episodes, for episodes occurring again. So that is the period where therapy definitely has a large role to play. In the depressive episode, also therapy has a large role to play. In the manic and hypomanic episode, also to understand the disorder better, to regulate, respond to the thoughts, to be alert to the fact that these thoughts are abnormal, uh, helping the patient sort of identify these abnormal thoughts is also definitely something that therapy can do in in the long run. And therapy is something that will actually help prevent repeated episodes and improve the long term outcome. So it's definitely has a very strong role to play.
Okay, can you share any personal experience of yours? Any case which you remember of bipolar disorder patient who has recovered very well and doing very well in life?
So there are lots of bipolar disorder patients who are doing very well and who meet me close to, uh, sometimes once in 6 months, sometimes once a year, and doing absolutely well, stably, just sticking to their medications regularly, and that's it. Uh, mm, on and off using therapy, but now so much back into their routines that they don't really need to even meet me often. So that's how effective it is, right? Bipolar disorder, once treated well and maintained well, they can have long periods, many years of no episodes at all. And the idea is to maintain that. And The worry is usually again when there are many years of no episodes, patients sometimes tend to become sort of lactacial and become unsure, so they may start skipping medications or missing medication. That's where again the risk of the illness does come back. So that's where we should be careful that yes, we are supporting them and we are also making sure that they are still continuing to take their treatments.
Any other inputs from your side about bipolar disorder in general? Would you like to talk a few words?
Okay. Yeah. So, like I said, bipolar disorder of all mental illnesses is actually a disorder that has reasonably good outcomes when treated effectively. So, I think people need not fear or worry about the illness. Uh, it just needs to be a group effort. The individual, uh, the the psychiatrist, the therapist, and the family together can definitely help uh, the person live a completely normal life, and that's the key to remember. It's uh, I wouldn't say it's curable, but it's very much treatable.
Okay, thanks a lot, sir, for your insightful sharings. Um, like, share, and subscribe my channel of Nitra Talks. Happy sharing.